Now, good afternoon. Everyone here? Good. I think it's Miss O'Neill now.
Thank you, my Lord. This opening statement is made on behalf of Scottish Care and describes Scottish Care's particular interest in the part of the inquiry's work which focuses on the impacts of strategic decision-making in relation to the themes of health and social care, insofar as those are matters related to the inquiry's terms of reference. It does not address other issues that the inquiry may consider at later stages of its work. Nonetheless, this is also the first occasion on which Scottish Care has had the opportunity to make a statement in the context of a hearing of the Scottish COVID-19 inquiry, and is grateful to the Chair for the opportunity to do so. In the circumstances, Scottish Care would wish to begin by acknowledging that the COVID-19 pandemic brought great trauma and pain to many people who received social care in care home settings, acknowledge the challenges faced by frontline staff, and acknowledge the impact upon friends and family members who were in many cases bereaved as a result of the pandemic, and who in other cases were unable to be with family members when they wanted to be. While Scottish Care's participation in this part of the inquiry's work is principally for the purpose of ensuring that the inquiry understands the impacts of strategic decision-making on those who delivered social care, it does so with an acute awareness of the impacts experienced by those who received that care. It will listen carefully to the evidence given during these hearings by those who can speak to that impact, and on behalf of those who cannot give evidence themselves, and it will do so in person where possible. Its Chief Executive, Dr McCaskill, is present in the hearing today and will do so virtually where it's not possible to be here in person. Scottish Care is a membership organisation and a registered charity representing the independent social care sector in Scotland. It works with its members and those who commission, regulate and use social care with the aim of creating conditions that support the provision of sustainable human rights-based care and support. It has approximately 350 members, which provide around 900 services, with some members operating several care homes or organisations that provide care at home. During the pandemic, and as is well known, Scottish Care's members were at the forefront of the frontline response to the pandemic, caring for older people and people with disabilities in residential settings and/or in individuals' own homes. Scottish Care was also directly and deeply involved in supporting its members in the delivery of those services and in communicating to Scottish Government and other decision makers the experiences, concerns and fears of those delivering social care services. Scottish Care's involvement in supporting its members and the response of the Scottish Government and others to Scottish Care and the social care sector during the pandemic are matters that Scottish Care anticipates being examined by the inquiry at a later stage. In relation to these impact hearings, Scottish Care considers that it can assist the inquiry by providing evidence about the impact of strategic decision-making on care providers and on individual social care workers. Those impacts are wide-ranging and continue to be felt. By way of a small number of examples, they include the following. First, the impacts on the health of care workers who contracted COVID-19 and whose risk of infection was contributed to by strategic decisions. Those include the prioritisation of the NHS in relation to the procurement of PPE and the failure to mandate the use of PPE in March and April 2020 when PPE was available only after positive or suspected cases had been identified. The failure to prioritise testing for social care staff resulted in staff having to take longer absences from work after coming into contact with a person who was COVID positive. By contrast, by mid-March 2020, NHS staff were receiving tests following such contacts so that they could return to work after a 48-hour period. This resulted in the care sector having to operate with a reduced workforce despite the increased challenges it was facing. This in turn led to staff shortages and also had a negative financial impact on social care staff who were, given their role, unable to work during periods of self-isolation. Second, the psychological and emotional impact on social care providers of strategic decisions that made it difficult for them to provide effective support for those in their care. One example was the difficulty that care home operators experienced in obtaining healthcare support for residents. Care home providers and care workers reported to Scottish Care a sense of what might be called clinical abandonment. And I note, my Lord, that the word abandonment has been used in a number of opening statements already today. That sense being reported in the early part of the pandemic, with care homes struggling to access GP services or to have GPs come into care homes to see patients. Many factors contributed to this difficulty, but Scottish Care considers that they include strategic decisions. So, for example, clinical guidance issued by Scottish Government in March 2020 created a belief that care home residents who had contracted COVID-19 should not be transferred to hospital. Although the guidance was later clarified, the practice of care home staff being strongly discouraged to transfer COVID-positive residents to hospital remained. In many instances, it was appropriate for the resident to remain in their care home, but the presumption of a blanket ban in transferring residents was unhelpful and placed enormous pressure upon care home staff, as well as being hugely damaging to individuals with ongoing and developing clinical conditions. Third, the impact on the morale of social care providers and individual social care workers of criticism which resulted from inconsistencies in national guidance. A particular example was public criticism of social care providers in relation to the provision of PPE to their workers, but without acknowledgement that national guidance prescribed different PPE requirements for staff working in social care compared with those working in healthcare settings. On occasions, media shared photographs taken of social care workers while they were providing care, together with criticism of the way in which PPE was being used. Fourth, the impact on care providers of strategic decisions made about scrutiny and oversight. One example was the announcement by Scottish Government in May 2020 of arrangements for enhanced professional clinical and care oversight of care homes, which instructed health boards and health and social care partnerships to establish multidisciplinary teams to scrutinise and support care homes. The result of this decision was that, in addition to inspections from the Care Inspectorate, care homes were inspected and visited by teams from Public Health Scotland, infection prevention and control specialists, and appointees of the Health Board Nurse Director, among others. This approach frequently resulted in contradictory advice and guidance being provided to staff and led to a clinical approach to care homes from practitioners who did not have any expertise in a social care context. In particular, infection prevention and control measures appropriate to an acute hospital setting were imposed on care homes by staff from an NHS background where, in the view of Scottish Care and its members, those measures were not appropriate. An example was the failure to recognise care homes as the homes of individuals with dementia. Personal items, which were often critical for residents' well-being, were assessed as infection risks and removed from residents' rooms, often causing real upset to those residents. Social care workers felt that in many cases their experience and expertise was not respected by those who provided oversight, and that their autonomy to make decisions in the best interests of their residents was reduced. While improvements were made over time, Scottish Care undertook research in 2021 into the impact of this oversight and scrutiny model being imposed upon the sector. Findings included a significant reduction in staff morale during an already challenging time. Finally, the financial impact on social care providers of funding decisions. The immediate financial pressures faced by independent social care providers, including due to the increased costs of PPE and loss of staffing, meant there was an urgent need to establish financial support. This process took time to establish and for the relevant criteria to be developed. Social care providers were not eligible to apply for business support funds that were available to other small businesses, and a separate funding process was developed by the Health and Social Care Directorate within the Scottish Government, specifically for social care providers. Difficulties arose as a result of the approach to funding that was adopted. Those difficulties involved payments having to be applied for retroactively and multiple changes to the terms on which they were available. The availability of funding was regularly extended on the week, if not the day, that the fund was due to end. This type of intervention did not allow for longer-term financial viability and business planning, and affected the stability of care providers. Due to its lasting financial impact, coupled with the rising cost of living, the sector is currently experiencing the highest level of care home closures in Scottish Care's existence. Scottish Care is hopeful that the inquiry will hear directly from individual care providers and social care workers about the impact on them of strategic decision making. There are, however, reasons to believe that many providers and workers will hesitate to come forward to give evidence to the inquiry. For many involved in the sector, the pandemic was an extremely traumatic period, during which they were put under extreme pressure, were exposed to significant risks to their health and to their livelihood, and witnessed the extreme suffering of those for whom they cared. Scottish Care understands that for many of those affected, they do not wish to revisit that trauma. There is also hesitation on the part of some individuals as a result of the ongoing effect of Operation Copper, the name given to the investigation resulting from the Lord Advocate's announcement in May 2020 that the death of any care home resident due to COVID-19 or presumed COVID-19 was to be reported to the Procurator Fiscal. This decision and the subsequent reporting and investigation of such deaths has caused trauma within the care home sector, and Scottish Care knows that individual providers and care home workers remain anxious about the potential consequences for them of Operation Copper. Scottish Care is able to assist the inquiry in relation to these impacts because of its direct and immediate involvement in supporting the social care sector throughout the pandemic. It was in constant receipt of information, concerns and questions from its members about the impact of the pandemic on them, on the social care workforce and on those for whom they were providing care. Its work during that period, in addition to extensive engagement with Scottish Government, local authorities and regulators, included substantial work to ensure that its members were aware of legislative changes and guidance issued by the Scottish Government, by Public Health Scotland, by COSLA and by the Care Inspectorate, and the impact that such changes and guidance would have on their operations. Amongst a wide range of activities and in order to actively support its members, Scottish Care delivered webinars on COVID-19 twice a week from the 17th of March 2020. Those were then added to by the hosting of surgeries to provide a forum in which members could ask Scottish Care questions and share information with each other. These provided Scottish Care with feedback from members in relation to what was happening in the care sector in each part of the country and supplemented the daily intelligence it was receiving from its regional staff based throughout Scotland. Scottish Care looks forward to working with the inquiry to ensure that the impacts of strategic decision making on its social care providers and social care workers are well understood. It will assist the inquiry in relation to this part of its work and in later phases of the inquiry's work to the greatest extent possible.
Now, the next co-participant we're to hear from is the Scottish Vaccine Injury Group, Mr. Bryce, I believe. Thank you.
It's customary, I've noted, to begin these statements by expressing gratitude to the Chair, both for being designated with co-participant status and for being given leave to appear at this stage in the inquiry. The Scottish Vaccine Injury Group especially is grateful because it is a group of people who have suffered, as has been set out in our opening statement, a degree of stigmatisation and public calumny. Quite often members of the group have been characterised as anti-vaxxers, which particularly wounds them, since by definition they would not be vaccine injured if they had not taken the vaccine. So I do expressly endorse the remarks of gratitude. I have lodged an opening statement, and the tribunal, the inquiry has that, and I adopt it. I will seek to move through it quite quickly because I want to focus on the submissions made at the end of the statement about the nature of the evidence which we would wish to formulate and present to the inquiry.
You can be sure that we will have read it. We've read
I knew that.
And that we will analyse it in detail, so feel free to skip to the parts you want to without hesitation.
I knew that.
Or fear.
The group, as is known, is one of the unusual groups in that it has core participant status in both the UK and the Scottish inquiry. The participation in the Scottish inquiry is under reference to term of reference D, the design and delivery of vaccines strategy. The participation in the UK inquiry is in relation to Module 4, vaccines and therapeutics. A word or two first about who the Scottish Vaccine Injury Group are. The Scottish Vaccine Injury Group were formed in September 2021 to apply for core participant status in this inquiry and to provide tailored support for Scottish people who have suffered an adverse reaction to the vaccine. Initially, membership was restricted to those who had themselves suffered an adverse reaction, but it became apparent that there were a number of people who had bereavements as a result of the vaccine injury, and from November 22, those people have been allowed to join. There are currently a total of 258 members in the group, of whom 15 are bereaved people. The founding members of the group are Ruth O'Rafferty, who has been permitted to come to the hearing room today, John Watt and Alex Mitchell. A few of the group's members are now full-time carers who've had to give up their jobs to care for a loved one, and some are still extremely ill. The group liaises with similar groups internationally, including Australia, US, and several European nations. The group has its own website, and people who are watching who have an interest in this, may I plug the website?
Adverts are allowed.
Thank you very much, my lord. The website is www.scottishvaccineinjurygroup, all one word, .org, and it provides everybody with a vaccine injury-related problem in Scotland with information and support. It's to be stressed that the group is entirely voluntary, and all the help that it gives to the vaccine injured is also done on an entirely voluntary basis, even although the people providing the assistance have challenging health issues. And one of the submissions which we would be wanting to make to the inquiry is that resources for the vaccine injured should be being provided primarily by health and social care services in Scotland, not by a voluntary group operating on a shoestring. It's appropriate that the inquiry should investigate vaccine injury because it's already been explored by the Scottish ministers. The 4 harms which are to be the subject matter of the inquiry include direct health impacts of COVID-19, but also other non-COVID health impacts. And the letter by the Minister says that there will be a person-centred human rights approach, and the submission for the group is that the scope and sequelae of vaccine injury would be encompassed by a person-centred human rights-based approach to a non-COVID health impact. So in my submission, we fall squarely within the terms of the inquiry. Now, there's been correspondence with the inquiry from which it appears that there is some concern that the group may think that it has a wider ambit in the Scottish inquiry than it actually does. As I have made clear, it's a matter of primary legislation that matters of drug safety, regulation and approval are reserved matters. They are not, even if the Scottish inquiry had wanted to make those matters part of it, the subject matter, it could not do. And the group is fully aware of that. The group is also aware that excluded from the Scottish inquiry are such other issues as the question of the delictual immunity which has been vested in the vaccine manufacturers. That is also a reserved matter. As far as the vaccine damage payment scheme is concerned, that is a UK matter, and questions such as the sufficiency of the level of the award or the fact that one has to establish a 60% level of disability before one qualifies for the award. That can't be dealt with by this inquiry. However, and that is of some interest, incidentally, to the group because a number of its members have received VDPS payments. What is relevant here, and a submission that will be made, is that the Scottish Government ought to have publicised the existence of the VDPS and funded advice agencies to assist with the making of applications under the scheme. And a submission which will be made is that the vaccine injured have been let down by the Scottish legal profession, which has not shown an interest in taking up the issue of making VDPS claims. The two core issues on the basis of which the application for leave to appear in relation to health and social impacts were made are to do with, first of all, the experience of systemic barriers to diagnosis. There are, there's set out anecdotally in the statement, there are people who have been diagnosed with vaccine injury and other people with identical symptoms who have not. And there is an experience by the vaccine injured of resistance by the medical profession, by the NHS Scotland, to identifying their injuries. The other issue, of course, is stigma, which I've already touched upon. There has been two of the groups, there has been some notoriety when an MSP tweeted about vaccine injury in derogatory ways. Even those who have clear diagnoses of vaccine injury are afraid to talk about it in their social circles. And the inquiry may be aware that the opening statement of Anna Morris KC to the UK inquiry on behalf of the vaccine injured was actually taken down from YouTube. And there is still the experience of social media sites censoring groups set up for the vaccine injured. So what should have been done? The submission of the vaccine injured is going to be this. The rollout of the COVID-19 vaccine programme in Scotland, leaving aside the matters of drug safety and regulation, those are clearly UK matters, but the rollout was a matter for the Scottish ministers, and I've set out in detail the legislation on the basis of which that was done. And critically, what that means is that the Scottish Government had sole control over the advertising and information environment. And the consequence of that is that it fell to, or ought to have fallen to, the Scottish Government to publicise, because all vaccines produce adverse effects. It's only a matter of how much. And the Scottish Government should have prepared the public for the possibility of vaccine injury. And not just to ensure that the medical system identified, recognised and responded to those, but that people themselves knew. Because some people knew straight away when they were received the vaccine, but some people have taken a long time to realise. And so our submission is that it was for the Scottish Government to have a publicity campaign during the rollout to alert vaccine recipients to the possibility of vaccine injury. The group's submission is that there should have been a media and professional awareness campaign simultaneously with the rollout to raise awareness of vaccine injury. Medical professionals would then have been on the lookout for symptoms, and the public would have been alerted to the possibility of injury and the need to seek appropriate treatment. Instead, there was this stigma around vaccine injury. Now, I want to say a word or two more about stigma before I turn to what I want principally to say about the evidence which we'd like to develop for the inquiry. One of the consequences of the background of stigmatisation, first of all, the group's members are often told that their post-vaccination physical symptoms are actually psychosomatic. This stigma is sufficient to compound other problems because people who have got vaccine injury can be with challenges with mobility, living arrangements, relationships and career. And that is compounded by it being said to them that the reason why they're not well is that they're not mentally well. This stigmatization is such that members of the group have been providing informal counselling and support for members dealing with depression and even suicidal ideation. And another of the principal submissions which the group would wish to make to the inquiry is that it should not fall to a voluntary group to deal with issues such as that. The issue around suicide risk is one on which NHS Scotland or the mental health charities should be dealing specific training to deal with the vaccine injured who have got those symptoms. So if I may turn to the evidence which the group hopes to develop for the inquiry. It's at page 7 of my statement. The group has had internal discussions amongst its own members and also discussions with its legal team. And we've attempted to develop a proposal which balances the restrictions on the jurisdiction with the substance of the subject matter which the group would wish the inquiry to consider. And it is thought we can get this down to about 5 witness statements. Now, I was greatly heartened when Mr. Gale this morning mentioned that it was hoped to reach the evidential part of the vaccine-injured evidence by February. I would just like to flag up that if we are to do even this modest programme that I'm proposing, it will take quite a bit of time. And I'm laying this out now in the hope that we can have a dialogue with the inquiry as to what can be done in the programme, the time within which it can be done. What we propose, 5 witnesses, broadly speaking, somebody who's got a clear diagnosis of vaccine injury and possibly also an award from the VDPS scheme. And the only reason that that might be relevant would be to support that the person concerned does have vaccine injury. Another member of the group with similar symptoms, but who has not been able to obtain diagnosis, so that we can pull out this question of why some people get diagnoses and why some people do not. And thirdly, a person of skill to illuminate the systemic barriers to diagnosis. We'd also like, fourthly, evidence to be led from a bereaved family member of a person whose death has been clearly attributed to vaccine injury. And lastly, because it is a matter to which the group attaches particular significance, a witness to the prevalence of suicidal ideation amongst persons suffered from or bereaved by vaccine injury and to the support needs of such persons. As far as the person of skill is concerned, I have set out that the group has informal contacts with a number of medically skilled people actually throughout the world, some of whom are known to provide advice to in litigations pro bono. But there is a question perhaps as to what value the inquiry would attach to such a skilled witness. So I set out that as a matter on which dialogue with the inquiry would be greatly appreciated. There is one last matter which does not fall squarely within the health and safety impacts, but does touch upon it and is going to be relevant in my submission at some point during the inquiry. And it is this, that although there have been a number of coroner's inquests in England where vaccine injury has been found to be established by coroners, there has, as far as I can find out, and I've been making inquiries, been not a single fatal accident inquiry. Now, while this inquiry has restrictions on it, jurisdictional restrictions on it in terms of subject matter, such as, for example, drug safety and regulation, I do not think a fatal accident inquiry would be subject to such restrictions. And it is a matter which I would seek to have canvassed in the inquiry as to why there hasn't been a fatal accident inquiry so far in Scotland. That may not fall within these impacts. I simply flag it up as something which, in my submission, is of relevance to the inquiry overall.
Thank you, Mr. Bryce. Can I say, and I'm sure I'm not speaking out of turn for him, Mr. Gale or a member of his team will be more than happy to discuss all these matters with you, including the scheduling of any evidence you might wish to offer us.
I think, my Lord, perhaps just to be clear for Mr. Bryce, I did indicate that it was anticipated and hoped that his group, if I can put it that way, would be accommodated within the period between February and Easter. I cannot offer a precise timing for that, and if it requires further preparation and further discussions, it may be pushed back in that period, but we hope to do it in that period.
I'm extremely grateful to hear that, and all I'm really flagging up is that it will be a time-consuming exercise and the time needs to be used. I'm very much obliged.
Thank you. Very good. Now, next, the penultimate co-participant today is the Scottish Healthcare Workers Association, Mr. Webster, KC. Mr. Webster, thank you.
My Lord, Scotland's healthcare workers have served the people of Scotland with courage and conviction, as it was for many of Scotland's key workers during the acute phase of the pandemic. They were the people who placed themselves at risk for the benefit of others. We recall how they worked tirelessly to protect and care for others. We recall them trying to manage the constraints and inadequacies of resources available to them, both for those in their care and to care for and protect themselves. We recall them physically and emotionally exhausted by the work they did for us. The acute phase of the COVID-19 pandemic may be behind us, but the disease and its consequences are not. COVID-19 continues to be an ongoing and very real threat to the health of individuals and to Scottish society. Sadly, people are still dying of COVID, and they are still suffering from the disabling effects of long COVID. There are many who continue to suffer long-lasting effects of the disease without adequate recognition or support, without any clear understanding of when, if ever, their symptoms may abate, and not knowing whether they will ever return to anything resembling their former lives and careers. For many, future uncertainties of care and support, both medically in terms of symptoms and rehabilitation, and financially in terms of employment security and state-assisted welfare, are a further crippling burden. They are the ongoing victims of the pandemic. This inquiry must now repay a nation's indebtedness to these individuals by investigating and reporting with similar courage and conviction to that shown by them as they faced the virus. Scotland's healthcare workers seek truth, accountability, and recognition for the harms they have suffered and continue to suffer, and reassurance that their suffering is not an inevitable fate to be repeated in future pandemics. The Scottish Healthcare Workers Coalition is a grassroots organisation comprising healthcare workers of all types, doctors, nurses, those in professions allied to medicine, and hospital and social care staff concerned as to the long-term effects of COVID-19. They've coalesced in seeking information and support as to not only the long-term physical effects of the virus, but also in respect of what became apparent as an all too common, woeful and discriminatory response by government, healthcare providers and employers to their circumstances. They look to this inquiry to record their experiences. The inquiry has determined to make this its first endeavour. So, let us recognise and acknowledge widely and fully the sacrifices made, the risks taken, and the exhaustion and the fear that was endured. This inquiry needs to identify, record, and chronicle the broad-reaching emotional consequences of the pandemic, including those arising from long COVID for these workers. The inquiry must also ascertain and preserve evidence of the economic impacts for these workers and the effect of the virus on societal infrastructure, including, again, the effect of long COVID. But then the inquiry must turn to our decision makers, then and now. It must show no fear or favour in ascertaining the facts of what decisions were taken and why they were taken, and to understand the analysis or lack of analysis that was undertaken. It must discover whether our elected Scottish representatives and their officers truly follow the science, both in the early stages of the pandemic and as our knowledge increased. Did they reflect upon and reasonably weigh the risks and advantages? Did they put public money to good and effective use? And did they take reasonable steps to protect the workforce that they sent out to do battle with the disease? Now, long-term post-viral illness was known before COVID-19, so the question must be posed, was that risk recognised at all? And if it was it reasonably balanced in the decision-making that occurred in the early stages of the pandemic? How prepared was Scotland in its distinct preparations for the arrival of virus to meet the needs of its population? Were unnecessary lives lost or blighted amongst Scotland's healthcare and social care workers? Were, as a consequence, unnecessary lives lost amongst those they strove to care for? These are the overarching issues for this party to the inquiry. And how has Scotland responded to the sequelae of the disease in economic and social terms, both for society at large and for those frontline workers we placed our trust in? The inquiry must look at what our Scottish elected representatives and public bodies have left us with as a long-term response to the consequences of the pandemic in employment, health and social security terms. Are they continuing to gather information, collate, analyse and plan in the light of ongoing long-term illness? Have they put in place protocols and funding to manage future risks of long-term illness? Have they considered the effect on healthcare and key workers of long-term disease? Have they done so to inform the state's response to not only those who continue to suffer, but also future generations? Have they taken appropriate steps to care for, provide for, and support those who continue to suffer? I ask, have they learnt anything? I ask, have they learnt enough? The legacy left by the state and the resilience of the state to provide for the future of those still suffering from the disease are the other overarching concerns for this party. The long-term effects of COVID-19 are many and varied. Long COVID is a multi-system illness. There are over 200 documented symptoms for long COVID. Severe fatigue, shortness of breath, loss of smell, muscle ache, memory loss, chest pain, insomnia, cardiovascular irregularities, dizziness, paresthesia, and joint pain are just some of the many recognised symptoms. And to narrate the same is to lay the basis for an understanding for the potential for and reality of long COVID having a significant impact not only on day-to-day functioning, but also on a worker's ability to remain in or return to employment. As much as long-term post-viral illness was recognised before the world had heard of COVID-19, the existence of long COVID as a common descriptor for prolonged symptoms and disability after the acute phase, that's to say following infection, is now well recognised. But it was not always so, and regrettably the inquiry is likely to hear of professional ignorance, if not antipathy, to the needs of those with long COVID. And so it's against that background that the Scottish Healthcare Workers Coalition come to this inquiry in the expectation that the inquiry will throw a searing light on the actions, practices and feelings of health and social care providers as employers and the Scottish Government as the policy lead and directing force in the management of the challenges of the COVID-19 infection and long COVID in particular. We trust that this inquiry will hear from witnesses who will speak to the debilitating effect of acute and chronic symptoms in COVID and long COVID in health and professional terms. If so, the inquiry will hear of the frustration of this workforce at the inappropriate protective equipment provided to them and the inadequate protection afforded to them in the workplace. They will speak to the financial and economic consequences for them as they have struggled and continue to struggle with the constraints of COVID and long COVID. They will speak to the frustration and despair of seeing professional careers falter and end as a result. Concerningly, and really as a matter of national shame, they will speak to sceptical, unsympathetic and unaccommodating employers with poor employment practices and lamentable state financial protection for long COVID sufferers. They will speak to employers in the health and social care sector who frankly ought to have known better, not responding to the individual needs of their workforce as those with long COVID wrestled to manage the particular effects for them and their own personal circumstances. And to employers unappreciative of long COVID, inappropriately pressurising staff suffering from long COVID to return to work to meet the need demanded by the pandemic, and then being unsympathetic in their approach to symptom-induced desires for shorter hours of working and prolonged periods of ill health absence after returning to the workplace. They will speak to loss of earnings and loss of employment. Our health and social care workers have worked tirelessly and exceptional risk to themselves to save lives and provide care. What they deserve is an investigation will look to see whether the Scottish Government, health boards and other health and social care providers have proper regard to their safety and welfare when planning for and responding to the pandemic, both as regards the protection of health and well-being of those individuals and also the protection of their ability to remain healthy to care for others. And so we ask a number of legitimate questions. Firstly, was proper consideration given by the Scottish Government and Scottish health boards to the risks for health and social care workers in the workplace? Was there independence of thought and analysis from Westminster and the UK Government? More specifically, as long-term post-viral illness was known before the pandemic, it was a foreseeable consequence of COVID-19. So we ask, was it foreseen? Were the likely long-term consequences identified, weighed, and acted upon appropriately in the assessment of the conditions in which health and social care workers would have to work? If not, why not? Did NHS Scotland, individual health boards and employers recognise and respond to the distinct needs of their workers with long COVID as knowledge expanded? Long COVID was being reported as early in the pandemic as mid-2020. So what steps were taken in Scotland to reassess risk and identify appropriate precautionary steps once empirical evidence emerged? Was the prevalence and risk of long COVID in the health and social care workforce separately assessed here? Or was an opportunity missed at the early stage of the pandemic to warn healthcare and social care workers and the public at large of the risks of long COVID and the importance of appropriate and adequate protective measures? Let me say this on protective measures. The public may view the provision of personal protective equipment in the health and social care settings to be a story of privilege, profligacy and perfidy as to the needs of frontline staff. That is a perception that this inquiry must address and expose. Were those who took personal risks to care for us placed at unnecessary risk due to inadequate assessment of the means of exposure and manners of protection, especially in the context of long COVID? Was the precautionary principle recognised and adhered to? If not, why not? And as our knowledge of the disease improved, was a change in guidance appropriate, and was any such change effective? And if not, why not? Looking beyond PPE, we now recognise COVID-19 as entailing airborne transmission. So did the Scottish Government, health boards and employers appreciate the potential and their need for high quality and effective air filtration and ventilation in health and social care settings to mitigate risks? And did they take steps to mitigate the risks and then meet the need? Did they, by the end of 2022, put in place appropriate standards for future air quality in such settings? Now, the only way to avoid long COVID is to avoid catching COVID-19 in the first place. Long-term morbidity was not only a factor that ought to have been part of the pre-pandemic planning, it must also have been part of the information gathering and planning for the next pandemic. So looking forward, have appropriate and adequate steps been taken to monitor and gather data as to the long-term effects of the disease in order to better understand the needs of this essential part of our care workforce in the future, and as to how the disease will continue to, and how future viral pandemics may impact on the provision of healthcare and social care in Scotland in the future. Has the Scottish Government set about and funded the gathering of relevant data to record, assess and weigh the effects of long COVID in individuals and the social and economic cost of workplace absenteeism and the cost of financial support for people with long COVID on sick leave? And finally, also the extra demands of the social care sector to support people with this debilitating illness. Has the Scottish Government set about assessing the emotional and financial effect on individual well-being and finances for those with long COVID? Has that government ensured that in the light of what was known by the end of 2022, that NHS Scotland and Social Security Scotland is adequately informed, funded and resourced to provide the specialist help and support that this cohort of sufferers needs? Is the legacy fit for purpose? And let me touch on one other matter at this point in time. We say this phase of the inquiry is the appropriate stage to consider the issue of discrimination, for it resonates in the extent to which proper and adequate care was offered to health and social care workers, both during the pandemic's acute phase and subsequently. That's to say, for those who are still suffering. We ask, was COVID-19 and long COVID recognised and responded to by government, health boards and employers in a manner that looked to and adequately assessed discriminatory effect? Did they assess the need for protection in an informed, nuanced and equality-sensitive manner that avoided discrimination in the workplace? Looking forward, should long COVID be recognised as a disability under the Equality Act, and should long COVID be formally recognised as an occupational illness? Most significantly for this group, the inquiry must also recognise that the debilitating symptoms of long COVID have had a material effect on the ability of those suffering to retain employment and maintain a career. The Scottish Healthcare Workers Coalition submits that the long-term burden of the pandemic has fallen disproportionately and in a discriminatory manner in that regard. And is it expected that the inquiry will address the question of whether Article 14 Convention rights against discrimination have been breached? So as we embark upon the work of the inquiry, I exhort you, sir, never to lose sight of the need to conclude the inquiry with clear findings of fact. It will only be with an understanding of what was considered and what was ignored, what was weighed and what was discounted, and what was done and what was not done, that lessons can begin to be learnt for the future. I admonish the inquiry team that there therefore needs to be rigour in giving careful and discreet attention to the consequences for this particular cohort of society who risk so much for us all. This party looks forward to and expects the inquiry to produce background research specific to the risks undertaken by Scotland's healthcare and social care workforce and the interplay of long COVID in the assessment of and the response to those risks. There also needs to be understanding of the practical consequences of long-term COVID-related illness and the steps taken to avoid and mitigate the same. And there needs to be accountability for failures, oversights, and indifference. This inquiry must, without fear or favour, be seen to address the issues I have outlined and the related questions that, for now, time and space does not allow us to be stated before the inquiry. And time must not be allowed to denude this inquiry of effect. COVID-19 continues to reap its deadly consequences. People will die from COVID-19 during the period of this inquiry. Many others will continue to suffer its consequences through long COVID. The inquiry must report at intervals to ensure that lessons learnt can be implemented and suffering alleviated. It would be all too easy, in the many disparate issues the inquiry will have to consider and report upon, to lose sight of this cohort's concerns and fears. I offer no apology for pleading their case as a special case. For them, the future is uncertain in so many ways. They are, as I've said, the ongoing victims of the pandemic, and they look to this inquiry to provide some answers. Could and should the Scottish Government and health boards have done more? And what they ask is, was their suffering unavoidable?
Very good. Thank you very much, Mr. Webster. Now that brings us to the last co-participant submission for today, Refugees for Justice. Mr. Kiddie.
Somewhat ahead of schedule.
For the good, I imagine.
My Lord, Inquiry Council, ladies and gentlemen, I appear here today as Junior Counsel for Refugees for Justice, as instructed by that group's solicitors, who are Burnberg Pierce. My learned senior, Hugh Southey, is also instructed. I want to start by quoting some of our evidence so far. First, I'll quote Baroness Helena Kennedy, KC, who chaired the independent inquiry commissioned by Refugees for Justice, which also investigated similar issues as these public proceedings shall consider. Speaking of the vulnerability of asylum seekers and refugees, she concluded in her report as follows. In her words, "It is the current systems of asylum, determination, and support that make them vulnerable. It places people into marginalised social and economic situations without adequate support and leaves them there with ever-diminishing hope for the future." And she says, "For those who have experienced trauma, this same system can compound the problem. We have heard almost countless stories of re-traumatisation and further trauma as a result of treatment." And I now also want to quote Manisha Keister, who is one of the coordinators of Refugees for Justice and herself an asylum seeker. Speaking of her own experience of lockdown during the coronavirus pandemic and of how she was treated at that time, she says, "We weren't even allowed to talk to other people due to COVID. We had little understanding of what was happening. Why were we there? How long would we be there? When would we move? I felt like an animal. That's the way they made me feel, so I just complied." These are just a few examples of evidence demonstrating how decisions of the Scottish Government about matters such as lockdown had a particular impact on vulnerable asylum seekers. Lockdown was obviously challenging for us all, yet it was particularly challenging for victims of trauma who were marginalised and lacked support networks. In this context, Refugees for Justice welcomes this inquiry's particular focus on the position of refugees in these proceedings so far. My purpose today is to introduce Refugees for Justice and then to highlight the following three principal points. First, that refugees individually and collectively are particularly vulnerable in society. Secondly, that the Scottish Government should have taken account of the vulnerability of refugees. And thirdly, that over the course of the material time in which this inquiry is interested, being the years 2020 2021 and 2022. It appears that the Scottish Government failed to take account of the vulnerability of refugees in its strategic decision-making in response to COVID-19. By way of introduction, Refugees for Justice, also known as R4J, is a core participant in these inquiry proceedings, being a group that was founded over the course of said material time. R4J was founded by asylum seekers and refugees who were directly, personally affected by the impacts of the Scottish Government's said failure, and who therefore decided to establish their group in reaction to that failure. Thus, in a very real sense, R4J is a campaign group led by refugees and asylum seekers and for refugees and asylum seekers. It also has strong connections not only with the refugee and asylum seeker community at large, but also with other groups and organisations which exist to help these people. For example, the Scottish Refugee Council and Refuigi, both of which have produced witness statements for R4J for the purpose of these proceedings. Here, 2 points bear clarification. First, R4J represents the interests both of those who had, by the material time, already been recognised as refugees, and also of those who had, by then, not yet been thus recognised, so were considered asylum seekers. For brevity moving forwards in these proceedings at large, the term refugees may be used for both. The second point for clarification is that while at the material time, and indeed nowadays, asylum was a reserved matter in terms of the Scotland Act in 1998, nonetheless, the Scottish Government was still responsible for the overall strategic response to COVID-19 in Scotland, including in respect of issues likely to affect the experience of refugees and asylum seekers for better or for worse. Therefore, contextually, UK Home Office policy remains relevant for consideration, given it contributed to the particular needs and vulnerabilities of refugees in Scotland. And the Scottish Government ought to have been aware of this, and it also ought to have taken account of it. So now moving on to R4J's first principal point for this inquiry. It is that refugees are particularly vulnerable in society. By the very nature of their status, they are people who have been displaced from their home nations by reason of hostilities, persecution, oppression, discrimination, natural disaster, economic adversity, and other similar causes. Therefore, they come to us out of disruption and dispossession and find themselves abroad in our country, which is foreign to them, in extremely disadvantaged circumstances, including past trauma and very often trauma-induced mental health difficulties, severance from home contacts, including family and loved ones, and uncertainty as to future outcome. R4J's second principal point is that the Scottish Government should have taken account of this vulnerability of refugees. For example, as said, R4J commissioned its own inquiry into asylum provision in Scotland, which had particular reference to failures during COVID-19, and where I have already quoted that inquiry's chair's chair, Baroness Helena Kennedy, KC, who said of the appropriate approach to vulnerability, again her words, "We have heard almost countless stories of re-traumatisation and further trauma as a result of treatment in the UK. It is very clear that trauma-informed approaches should be the norm in how we treat asylum seekers." And in R4J's written submissions, as already submitted to the inquiry, public law, human rights law, as well as good practice, all require this vulnerability to be taken into account. Yet, R4J's third principal point is that over the course of the material time, it appears on the basis of available evidence that the Scottish Government failed to take account of the vulnerability of refugees in its strategic decision-making in response to COVID-19. In terms of the accounts of R4J members, their overall experience of lockdown included the Mears Group rounding people up to relocate them out of and away from safe homes and into overcrowded hostel-type accommodation, typically by summary means on little or no notice, and at a time when more general advice to the populace at large was to isolate and to stay at home. And their experience also included removal or curtailment of financial provision, for example, resulting in the effect that they could no longer top up their mobile phones in order to maintain contact with loved ones back home, or indeed even with legal or other advisors. And inadequate access to medical, dental and mental health assistance, and inadequate official communication in respect of vaccination, self-testing and self-isolation, including official guidance. And overall, the Scottish Government failed to take account of this type of experience in its decision-making. Much of this is also reflected by the terms of Baroness Kennedy's said inquiry, as already mentioned. While some of the matters above were not directly the responsibility of the Scottish Government, they had an impact on the way that refugees experienced decisions of the Scottish Government, such as lockdown. For example, lockdown limited the opportunity of refugees to build support networks. However, so far there is no evidence that these matters were considered or that consideration was given to mitigating them. Finally, therefore, in conclusion, R4J welcomes this opportunity for this official Scottish COVID inquiry to find and to recommend as follows. First, that refugees are indeed particularly vulnerable in society. Secondly, that the Scottish Government failed to take account of this vulnerability in its strategic decision-making for COVID. And thirdly, therefore, that the Scottish Government should take account of this vulnerability in relevant future such strategic decision-making. And indeed, we would even go so far as to invite this inquiry to consider recommending a statutory requirement to take account of the vulnerability of refugees going forwards. That concludes the oral submission for Refugees for Justice, and thank you very much, my Lord, for this opportunity to make it.
Thank you very much indeed, Mr. Kiddie. That's all. Well, as Mr. Kiddie observed at the beginning of his submission, we're ahead of schedule, well ahead of schedule, to which I thank you all. We will adjourn now and reconvene at 10 o'clock tomorrow morning. Thank you.